My name's Eithan. I was the TCH whistleblower, and that all started when I was a surgical resident at Baylor College of Medicine in Houston, Texas, and you know it was such a privilege to be able to go to a program like that because Baylor is one of the most prestigious surgery programs in the country, where you're affiliated with all these hospitals in the Texas Medical Center that offer some of the best training. One of those places being Bentab, which is a trauma hospital where you literally have the godfather of trauma surgery, Ken Maddox, who started there and kind of pioneered all of the key trauma techniques in the field. But then also one of those places was Texas Children's Hospital, which is an amazing hospital for taking care of sick children. And really starting in 2020 is when things started to go south in the profession, because I did my training between 2018 and 2023. So I was able to see how things changed before and after COVID. And of course, one of the changes was the transgender madness. And I remember seeing, I had no idea what this was until like libs of TikTok. Yeah, and like gender affirming hysterectomies and mastectomies. I just couldn't believe it. I thought these things were going on in Washington and New York and Oregon, but no way did I think it was going to happen in Texas. But then I found out that it was happening at the hospital I worked at. The surgeons I worked with were doing these procedures. They were implanting puberty blockers into 11, 12-year-old kids who believed they were the opposite sex. And not only were they doing it, but they were lying about it. So, it took me a long time to really, you know, acknowledge that this was happening because it's hard to believe. But I blew the whistle after reaching out to journalists for 5 months. And then Christopher Rufo took the story, released it on May 16th. And then partially because of that story, the Texas Senate on May 17th passed a bill banning these interventions in the state of Texas. And then 3 days after that, the Texas AG announces an investigation into TCH. And then a week after, another whistleblower comes out, an anonymous nurse at the time. I didn't know her, but she worked in the clinic and kind of exposed this house of horrors. And then, I was still anonymous, but then, the feds came to my home a month after, on the day of my graduation from surgical training, one of the most important days of my life, a few hours before the ceremony, before I was about to meet with my parents. And they handed me a target letter, and a target letter, for people who don't know, is just informing me that I'm a target of a criminal investigation. And that letter was signed by a United States Department of Justice attorney.
Wow. Yeah, that's scary.
Yeah. I
So
still went to my graduation that night.
man,
It was, we were
wow.
so angry. It was, you know, you kind of have this moment where you freak out after the feds come and you don't
Yeah.
expect it. But then afterwards, we were just filled with, it's kind of a
hmm
hard thing to describe, but you're like, no, like you're, we're going to fight back. Like you're not going to give in.
Yeah.
And so my wife
hmm
and I sat on our patio for the next couple of hours before the graduation and like drank champagne and listened to Vietnam War music, you know?
Get motivated. Yeah.
Yeah. Yeah.
Um, yeah, I mean, when it comes to doctors across the country, there are a good amount of them that have been speaking up like you did, but I feel like it's rare. And you can maybe speak to that, but maybe like I'm interested to understand what motivated you as a whistleblower to come out and say these things when there is a lot of risk, a ton of risk, and a lot of people who are doctors don't take that risk. So just kind of what motivated you and what makes you unique in that way to do that.
And, I think there's actually a very few doctors, who speak out because really, there's so much risk. It's, if you work in an academic medical center, but then also the social circles in medicine
hmm
are like a iron domed bubble of craziness. But what motivated me was what happened during COVID, because that was during my surgical training, so I was at the very bottom of the totem pole. And a lot of people hear about these stories of what was happening in the hospitals where you know people were dying alone without their family members, where uh, all of this was happening. But I saw it firsthand every single day. That was my job for years, and the things that I saw were just horrifying. It was like I was transported into a different universe, and so every day it was like being part of like this massive crime against sick people, and I was a part of it
Mhm.
because even though I tried to fight back against what was happening, eventually, ultimately, I went along with, I stayed silent about it. Whenever I would speak up, like there was a lot of pushback. There was one time where I was almost fired because a gunshot wound came in and they put a mask on him. And then, I was like, it's totally insane to put a mask on someone who just got shot. So I took it off, and
Mhm.
then, the people, the doctors in the ER freaked out. And then, but, I would see people suffer for weeks. These older people who were already, prone to delirium and dementia,
Mhm.
and they were alone for weeks. Their family had no idea what was going on, and I would call them and try to update them and do everything I can to sneak them into the hospital. But these people would die, and they would die without the people they loved the most. And every single day, I would go home, and I was just filled with rage. And I'm a very easygoing person. I have a very kind of easy disposition, very kind of content, and but I was just filled with rage during that time,
Mhm.
and I was angry at what was the world around me, like what we were becoming, but mostly I was angry at myself because I felt like I wasn't doing something. And then when I saw what was happening at Texas Children's Hospital, I thought to myself, well, if I don't do something about this, then I'll never be able to live with myself in the future, because at some point I'm going to have children, and what are my children going to think of me if they knew I was there during that time and I didn't do something?
Mhm. Yeah, that's what I've felt too the past 5 years when I've started to get into this whole topic in the gender affirming care, which is actually called sex rejection procedures, as we'll get into. That's the actual real that's the real term of going on when those procedures happen on people. When I started getting into this, I was really just I gotta be like, what line am I willing to draw and where? Like, how far are you willing to go? There has to be a line somewhere. And because we have seen throughout history and also with this, things just keep getting worse and worse and worse until people speak up and start to push back on things that are very harmful. So, and we have to do that. We have to do that in our own lives, even with personal relationships. Sometimes you have to draw a line and say, like, hey, I'm not going to support this any longer, you know? And so we all have moral duties to do that when the time comes. And a lot of people wait too long to do that, and so
Yeah,
I think that's absolutely great, and a very rare quality where somebody is able to speak up against the huge, whatever it is, institutions or personal like, issues or whatever it is. It takes a lot of courage.
yeah, and that was a conversation that my wife and I had before I blew the whistle. It was
Hmm.
actually something we had to talk about, because what were we willing to sacrifice if I do this? And they come back at me. Are we willing to sacrifice our jobs, our futures, our money, everything, like these material things? And we really talked a lot about it, and the answer was yes. So the
Hmm.
day the feds came, it helped having those conversations before, because we were so deliberate about it. When they came, we were ready for it. Of course, it was scary,
Hmm.
but now we were in that moment where it's like, oh yeah, like now we have to sacrifice. Like
Hmm.
we're going to lose everything. And over the next couple of months, they came to my home June 2023. By September, we we spent $300,000, all of our life savings, everything we ever worked for, in legal fees. Uh, but we were still willing to fight, because it was worth it. It didn't matter that we lost that money. Yeah, it sucked, but not only were we willing to lose that, but then when they came to my home the year after and indicted me with 4 felonies and were going to send me to prison for 10 years, it was like, well, am I willing to lose my freedom? Like, absolutely. Yeah. Yeah. There would be no doubt in my mind. And then when people were trying to kill me, it's like, yeah, am I willing to die for this? It's like, yes, of course I am. And that's kind of it really got that crazy. It got that insane.
Mm-hmm.
But you have to draw that line. You have to be willing to stand for it because you know that
Mm-hmm.
there's something greater that we're fighting for.
What did they indict you with? I can't even begin to think of what they could have possibly charged you with.
So it was the when the story came out May 16th, 2023. In that story was that the information I gave to Christopher Rufo. There were 3 things in it. There was a Grand Rounds lecture, a Zoom conference. It was called like Gender Affirming Care in Minors, right? At a program that supposedly didn't exist. There were like 150 medical students where they were talking about, doing this at Texas Children's Hospital, um, uh, and then, but it was also like definitive evidence that the hospital was still seeing patients and operating on them. And all of that information was completely de-identified, and so there was even no cause for a HIPAA action, um, because it's the same information that's released to news agencies about COVID. Like, for example, if they had 10 people come into the hospital, between the ages of 20 and 50 who came down with an infection, that's public health data that is pertinent to the public. So they de-identify it, they release it because it has public interest. And this is the same exact thing here. There are so many examples of doctors using de-identified patient data in public medical conferences, in a million YouTube videos, in public stories in the news. So, and all this information that I gave to Rufo was also things that were publicly available in the hospital, where if you were a janitor, you can see this information. Yeah,
Mm-hmm.
it's crazy.
So they're being completely hypocritical with how they applied the HIPAA law there in that situation. Just
Yes.
yeah. Mm-hmm.
So it's not necessarily hypocritical. It will hypocritical, yes, but actually
Mm-hmm.
unprecedented,
Mm-hmm.
because they were charging me with 4 counts of HIPAA-based crimes. The and I kind of have to be careful about what I say about this, because there are some things that might be coming out in the next few weeks,
Mm-hmm.
um, legally, that are to my benefit. But I think talking about that shouldn't be a problem. But um, so they were charging me with disclosing, accessing and disclosing confidential patient information in the first
Mm-hmm.
criminal indictment. That was from May 2024. But when you look at their indictment, when you read it, what they claimed was that I had no reason to be at the hospital, that I accessed patient records, and that I disclosed confidential private health information. And what was remarkable is that all of that was flagrantly false. And the Department of Justice's own evidence proved it was false. The reason we knew that is because after the indictment, the attorneys have to give my attorneys something called discovery. Discovery is the evidence that they use to make their case. In the DOJ's own evidence, they had very, very clear documents that proved everything they were claiming in their indictment was false. About me working there, their documents prove that. About me accessing patient records, the records I accessed was transplant patient records. That's what they were charging me with. Surgery transplant. It wasn't about gender patients. They were using that as the premise to charge me, to make it seem like it was about these gender patients, but it was
Mm-hmm.
transplant surgery patients. The reason, and that's true, I did 100% access transplant surgery patients, but as a chief resident at Baylor College of Medicine, that's part of our responsibility, because I'm
Right.
a chief resident working at Baylor St. Luke's. Texas Children's is attached to Baylor St. Luke's. We work in the same room as the transplant surgery team. So oftentimes, well, not oftentimes, we are required to have a working understanding of those patients, because residents on the transplant team oftentimes ask us about those patients. And then also, we may be asked to operate on those patients by
Mm-hmm.
the attendings, because as a chief resident, um, you're have more skill than the lower level residents. And then once we made that known in court, of course, the first indictment falls apart. And then it gets even more crazy, because in the second indictment, they drop the language about me not working there, about uh, harming patients, the hospital and patients. And they say it's harming the hospital and doctors. So it was the first time in the history of HIPAA that the Department of Justice was charging someone not for disclosing patient information and harming patients, but rather harming a hospital and doctors, which
Mm-hmm.
have no response, no protection from HIPAA about what they're doing
Mm-hmm.
in a hospital. And then there were major issues with with the Department of Justice, and financial conflicts of interest with
Mm-hmm.
the hospital, which is
Yeah.
it
Yeah.
gets even crazier from there. And then yeah,
Yeah, conflict of interest is something that we have seen time and time again at every single layer when it comes to these sex projecting procedures. It's just every single layer has a conflict of interest. But when it comes to the argument that a lot of people will suggest that you as a doctor, if you don't believe in gender or gender medicine, that you'd be mistreating a patient somehow. So how would you respond to that kind of suggestion that you're the one actually harming these patients who are requesting these types of procedures and not giving it to them?
yeah. Well, I would say it's not necessarily a matter of opinion whether you're helping or harming these people. It's a matter of fact that you actually indeed are harming these patients, because the central proposition of these gender interventions is that these people are born in the wrong body, and that pursuing these medical and surgical interventions to align them with quote unquote their gender identity will improve long term outcomes is completely bogus. There's not even a medical rationale behind it. So, to expose these children and these adults both to hormones, puberty blockers, and surgeries is to do nothing to restore or strengthen their baseline health. All it does is to expose them to the massive iatrogenic harm from these interventions. It's cementing a delusion into their mind by the physical changes in their body, because they'll never be able to come back from that. Even a short period of time, like a couple of months, a year, 2 years on hormones or blockers. I mean, you can have profound physical changes,
Mm-hmm.
and those things bear out in common sense analysis, but also in the numbers. These people
Mm-hmm.
have a higher rate of suicide attempts, right? Of a lower life expectancy. These people are consumed with anger and rage, right? Which is why they have a higher chance of shooting up schools or assassinating people. It's why someone like
Mm-hmm.
me, people will call my phone and send me text messages trying to kill me.
Mm-hmm. Yeah. Yeah, there's a huge comorbidity of mental health problems that accompany those types of feelings that you're with when you have extreme discomfort in your sexed body, and there's all those comorbidities that can just that are really at the root. People often claim that gender dysphoria or just feeling that extreme discomfort in your body is actually the root cause of those comorbidities in a way, but it's the other way around. Those comorbidities drive and inflame the discomfort in the sexed body, and
Yeah,
and yeah.
because it's the in the gender proposition, the central proposition they offer is that all these other comorbidities will be solved by this. That
Mm-hmm.
they are a result of this incongruence between what you were born as and what you really are. And it's so patently absurd that, it's hard to believe that we're even at this point talking about this
Mm-hmm.
issue. But yeah, it's a complete inversion of medicine. It's
Mm-hmm.
as many other things in our society have been inverted. This is one of those, and it's just what makes this so devastating is that it's happening to people and is being perpetuated by doctors, which were the ones who were supposed to protect people, who take care of people during their most vulnerable moments.
Yeah, like the core of the issue, like you described at the beginning, is that someone with when it comes to gender dysphoria and the belief that we should be giving them these sex rejecting procedures, the gender affirming care, fundamentally it's a belief that you were born in the wrong body. So it's a metaphysical claim. It doesn't have any basis in reality. You can't be born in the wrong body. You just are. You're just born in the body that you're in. There's nothing there's nothing wrong with it. I'm like there's people who have developmental disorders, right? Where they might have they don't grow limbs properly, or disorders of the reproductive system, like we talk about a lot with DSDs. But they're not born in the wrong body, even in that case. They just have a developmental disorder in part of their body. And so it's a complete rejection of reality. And when you compare that with this a mental illness plus giving them these irreversible procedures on the body, it's just unprecedented levels of harm that we haven't seen in a long, long time.
Yeah,
So,
and really, I don't think there's anything in medicine. There has never
mm-hmm,
been anything like this. People,
mm-hmm,
people compare it to lobotomies, but even lobotomies were, first of all, that was done a long time ago when doctors still didn't have a lot of understanding. They had enough understanding to know it was probably pretty insane, which is why it kind of fell out of favor. But lobotomies were still reserved for the most severe cases of mental illness. It was like this last ditch effort, whereas these gender interventions are the first and only thing, and claimed with the utmost confidence to be safe and effective and supposedly reversible. Um, and Yeah, it's in the strength of these medications, the hormones and the blockers are two of the strongest, most potent interventions you can take as a medicine. It's People always kind of perceive the surgeries as really the most radical intervention. It's kind of like this graded approach, but I always saw it as kind of equal, because a surgery, you go into an operating room, the surgeon operates on you, and what really animates people, what really horrifies people, is that you know you these kids go in and these people go in and they come out without breasts, right? That's pretty shocking. And then you see the images of it, and really elicits a lot from people. But when you think about the hormones and the blockers, it's the same effect that's being done, but just because it's over a longer period of time, it's easier to accept it. Because what these medications do is essentially the same thing as surgery, but they do it on a microscopic level. Because every single day you have these chemicals floating through your body, the hormones and the blockers, and they're affecting the cellular architecture of your uh, of the cells in your body, and that architecture is changing in a way to manifest itself in your physical changes. So once those changes happen, then they're never going to go back. You're
yeah,
gonna be left with the permanent effects of it.
yeah. With surgery, it's like you said, it's very barbaric looking when you see what they actually do to people when it comes to the surgeries. But when it comes to the puberty blockers and the cross-sex hormones, those go far beyond just the superficial appearance level. People like to think, "Oh, I'm just changing my secondary sex characteristics and that's all fine." Well, you're also impacting every single cellular function across the entire body and across all your tissues, brain, heart, like, and go on and on and on.
Yeah,
And
there's no
yeah,
surgery in the world that can cause a boy to have a micro penis, right?
mhm,
Like if you have puberty blockers to prevent your growth through puberty, you will have a micro penis, right? You will become infertile. There's no surgery in the world that can withdraw the density of the bone from young children. There's
mhm.
no surgery in the world that can withdraw the sex hormones from these kids' brains and prevent them from developing psychologically. It's it's in when you think about what these medications are used for in other instances, right? Lupron is used for advanced prostate cancer. Even the hormones are used in advanced cancer, and
Mm-hmm.
these are cancer drugs. These are used only in the most severe of situations.
Yeah, last ditch effort, not when somebody has extreme discomfort in their body and they're wanting to have help with that, and you give them these medications. That is a completely different use of the medication. And I even saw an argument that, oh well, it's not a problem that these are off label. Off label medications are used all the time. And so these are not necessarily a problem either. They're experimental and important to use because we're trying to save people's lives. And again, it's conflating a lot of things together. Those aren't comparable to other medications we use off label, for example.
And the because the central issue um, is there a medical rationale behind it? What problem are you trying to fix? Because as a doctor, everything you do is directed at diagnosis, which is the identification of a problem, and then treatment, which is the resolution of that problem. In these instances, they can't even illustrate what their problem is. They can't even define it.
Mm-hmm.
Their definition for gender identity is circular. They say it's an individual's belief in or their identification in gender, but you can't use the term to be defined in the definition. And
Mm-hmm.
they say sex assigned at birth, but that's biologically incoherent. The problem that they're trying to solve is a delusion of their mind.
Mm-hmm.
So but this delusion is then being tied to something very physical, and uh, so even for people who are trying to say it's experimental, even the experimental things, you have to justify that experiment with at least a rationale. When you had these really advanced, really invasive cardiac interventions that were done, like in Houston at my program, like the something called the left ventricular assist device, which was used in heart failure patients. It was a device that would be inserted onto the heart and help the heart pump and would serve as a bridge to heart transplant. The first patients who got these devices, there was a massive mortality, like 90%. Most of these patients would die very soon after. But because there was a medical rationale behind it, it made sense, right?
Mm-hmm.
It developed over the years and now has become something very effective and is used widely. But in this case, there's no medical rationale behind it. So even to say it's experimental is illogical. It's unethical. There's no
Mm-hmm.
justification for it because what you're doing is experimenting on someone with no potential benefit. It's like designing an experiment of jumping off of a building, right? It's like no, like it's that the what the effect is going to be
Mm-hmm.
because it's logical what the effect is going to be, no matter
Yeah.
what your crazy idea about gravity is.
They can't define this experimental parameters at all because like you said, they can't define what gender identity is in an objective way. They can't define the outcome or what they're trying to actually solve fundamentally. They're it's just such a mess. Um, was also interested in your legislative kind of work in terms of helping foreign policy. So, helping foreign policy, rejecting gender ideology, and protecting the integrity of medicine. So, what are some of the things that you've worked on that you're most proud of, or that you think have had the most impact?
Yeah, I really think that's the most important thing moving forward because what these people did to me with this prosecution is the most evil thing I could have ever imagined. Where they tried to put me into a cage for something that for a crime that I never committed, but also the reason they did it was because I did the right thing, right? That's why
Mm-hmm.
they had to invent this new interpretation of HIPAA. And after my case was dismissed in January of 20 of this year, you know, for months I was really, it was I it's hard to describe what you feel, but you just feel like this resentment, like this anger towards being put through this process. And then I discovered incidentally during my case too that um, what was happening in a lot of these gender clinics was that the doctors were relying on false billing codes to, you know, um, deceive insurance companies, both public and private, about what they were doing. So after my prosecution ended, I started looking into this and I started doing more and more investigation. And it took me a very long time to really understand it. But what I realized is that it's much more prevalent than than even I thought in the beginning. So just to kind of outline the basics of it, um, medical fraud is a very well defined part of criminal law, where it's when doctors or hospitals fraudulently bill public and private insurance companies with the intent of receiving insurance payment for services that weren't rendered or didn't have a reason to be rendered, or that there was something else where um, they were doing something where they wanted to get paid, but they couldn't do it in the original way. So, given the nature of these interventions in gender clinics, because of the poor evidence, but most importantly, because of the diagnosis coding system in the United States, namely ICD 10, when gender doctors submit a billing code to an insurance company, they only have a choice of five. It's gender identity disorder F64.0 in ICD 10. That is classified as a mental health disorder in the coding system. So when those claims go to insurance companies, what these insurance companies often do is give pushback or they deny the claim. So the gender clinics will become insolvent if they were unable to get reimbursements for the hormones, blockers, and surgeries. What they do in response, right, to increase access to this medical care is they use fraudulent billing codes. And what I mean by that is they submitted false diagnoses to insurance companies in order to receive payment for hormones and blockers and surgeries. An example of a false diagnosis is endocrine abnormality unspecified, which is a complete separate category. E34.9 describes rare genetic conditions, carcinoid syndrome, adrenal insufficiency, and it's the initial evaluation of a patient when you're unsure of what their hormonal situation is. But the reason that the gender doctors use this diagnosis code is when they submit it to an insurance company, what that insurance company sees is only the patient's age, sex, the diagnosis code, and then the CPT code. The CPT code relates to treatment. Um, so when the treatment was hormone supplementation and the diagnosis, an endocrine abnormality, the insurance companies see that and are like, oh yeah, no problem. They reimburse the doctors without question. The problem is that is statutorily a crime. That is a very big deal. If I were to do that, I would be in a prison cell. From the evidence I've seen, but also from what's available publicly, this is not something that's rare. This is not something that they used sparsely. This consists of 95 to 98% of all the claims submitted by many of the gender clinics, especially the ones in red states.
Wow.
And
So
the other
they're
means that they
specifying.
did this, the other reason why they would do this is to conceal the scope of the practice. Because like the Do No Harm database, right? They looked for these patients by looking for how many had the gender identity disorder diagnosis affiliated with the hormone in the puberty blocker CPT code. All these other patients were not identified in that database, so it conceals the scope of the practice. But then also, this is how doctors conceal the program in states with legislative bans, because there's no way to know that these doctors are quote unquote doing gender affirming care, because everything that's available to the public is endocrine disorder unspecified or precocious puberty
Mm-hmm.
or something else.
That's crazy that they're saying that it's endocrine disorder unspecified, or even just endocrine disorder, when it clearly is not an endocrine disorder, because these people have perfectly healthy bodies, perfectly healthy hormone levels, like
Yeah,
for almost in almost all
the only
cases.
the in all the cases, every case, the only endocrine disorder these doctors are treating are the ones that they're giving to their patients. That's what's
Mm-hmm.
going on, right? These
Yep.
the patients in these gender clinics do not have an endocrine abnormality. There's
Mm-hmm.
none. Their labs are perfectly normal, but the
Mm-hmm.
way they're manipulating it, you know, the way they perceive it is that because the labs are normal, that's why they have an endocrine abnormality. Because in it, they believe that if this person says they're a boy and they're really a girl, then that's what their lab should reflect. So
Mm-hmm.
in their documentation, what these doctors will do is say, use these terms like female to male labs, FTM labs.
Mm-hmm.
So the way they look at the labs is the more abnormal the labs, the more they are consistent with the children getting better. It's so sick and twisted that not only did they invent this completely insane field of medicine to mutilate and castrate these children, but they defrauded public and private
Mm-hmm.
insurance companies to do it. And in order for them to do that, it required a huge involvement of the hospital systems where this was being done at, because there's surveillance systems in place to identify these issues, and all these surveillance systems failed for some reason.
Mm-hmm. That's one of the things too. It's like a cascading failure on every single level that affects like all these defenses that were in place to stop things like this from happening and defrauding, for example. That it's just all those failures just went down the line and just went through each tier, and here we are.
Yeah.
Um, yeah. So like, what do you think we should do as a society in terms of, or even on a legislative level, on a cultural level, to affect change and stop these kinds of things from happening?
So the good thing is that it is I believe it's doable. On In terms of the fraudulent billing, these are well defined statutory crimes that happened
Mm-hmm.
in many of the gender clinics in the United States. The laws exist on the books today to go after these clinics, doctors, and hospital administrators who are involved in it. All that has to happen is state AG offices, state attorneys, and Department of Justice prosecutors to start going after these doctors based on laws that already exist. So this is nothing legislatively or anything else. And that would be good if we did do that. But what these doctors did is already illegal based on criminal statutes that have been in place. All we have to do is enforce the law. And a lot of this evidence is available to these law enforcement authorities, whether it's a state attorney general's office or a federal law enforcement agency. All they have to do is start looking. But I think that the main barrier to overcoming it, the activation energy to start pursuing these cases, is the knowledge deficit. Because just based on my conversations with people who are in a position to pursue these cases, they can't necessarily understand the scope of it or the severity of it, or that this was actually able to happen. Because they hear that, oh yeah, like 95% of all the claims coming out of gender clinics, which probably amounts to hundreds of millions of dollars, were fraudulently billed to Medicaid and private insurance. Like they can't wrap their heads around that. Like an endocrine abnormality unspecified. Like what is that? They can't understand it. So the 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 barrier to overcoming that is just informing these people, convincing them. It'll take a little bit of time, and I'm in the process of doing that. But I'm hopeful that that's what's going to be the most effective route,
Mm-hmm.
because the legislative thing, it'd be great, but our Republican elected officials are spineless cowards for the most part. You know, we can um, release all the white papers we want, and which is good. We still should. We should still try to convince hearts and minds, but it's important for us to come to the conclusion of like the reality around this is that the political left, a lot of these people are intractable in their commitment to this ideology because many of them have been a part of these crimes that were perpetuated, to these people. So they
Mm-hmm.
can't, self-reflect and necessarily change their mind because that means they have to acknowledge that they were the ones who
Mm-hmm.
were the monsters that they accused everyone else of being.
Yeah, that's a huge cognitive dissonance thing to overcome. Most people aren't willing to acknowledge that they are the ones complicit or directly involved in really deeply harming somebody, because a lot of them do probably really deeply actually believe in this in terms of the ideology. But yeah, it's just it is hard to get it out of everything that it's in. So I guess my next question was basically like, do you see that medicine is pulling away from gender ideology and these sex rejecting procedures? Maybe it's happening in pockets. Uh, I have seen it. There is a lot more knowledge now on this issue across the culture in the past year, even 2 years. But have you seen medicine itself kind of pulling away from it at least?
In certain circumstances, yes, where you'll have maybe the average doctor who's willing to express opinions
Mm-hmm.
that this is completely insane. But in terms of institutional American medicine, absolutely not. It's gone the other way. The institutions in medicine, like for example, the professional medical associations, you know, uh, um, all these prominent doctors have only doubled down on it. And the reason I think it's for the same reason is that because they were so complicit um, in this practice, they have to go down with the ship. But specifically because many of them had committed crimes in the process, especially in terms of the insurance coverage.
Mm-hmm.
That if they give an inch, what they're going to do is open up the books to themselves for a huge amount of liability.
Mm-hmm. Yep. Yep. Absolutely. Um, so the other thing was we have a friend who's currently in medical school right now for plastic surgery. And he's told us a lot about how gender ideology is shoved into their curriculum. And he's in a very, very red state. So as you mentioned yourself that even in the red states, this is happening like crazy in these hospitals. And so I guess the question is like, what can be done to get this out of medical school, and how should someone like himself approach this when it comes to teachers trying to teach him this ideology in his medical school?
Yeah, it's important for people to know, even if it's in a red state like Alabama, Texas, Mississippi, that major academic medical centers in those states are these pockets of deep blue ideology. Like the Texas Medical Center, if you might as well take that and it's a transposition of the craziest aspects of San Francisco into the heart of Texas. So even if it's in a red state, it's not like that has any effect. And because these medical centers are so powerful, they have the ability to protect their institutional capture because all the CEOs, the boards, all these people are have a huge sway financially, and all of them are captured. These people either they're captured or they're cowards, especially in the case of the Texas Medical Center. So um, it's a very difficult thing for people in medical school, and especially residents or even doctors at the beginning of their career. Really, the only group of people who have kind of like a um, consequence-free chance to do something are people at the very end of their career. But I think it's important that people do speak out, but really you have to be careful for it if you're a medical student because they will destroy you. Did you say he was in residency?
Not yet. He's going through medical
Yeah.
school still, but I think he's got maybe a couple years until residency. So,
Yeah. Yeah. What state?
Oklahoma.
Yeah. Yeah. So
Mm-hmm.
the reason you have to be very, very careful. My recommendation to him would be if he feels like this is, or her, I don't know, it's
He. Mm-hmm.
he.
Mm-hmm.
If my recommendation would be if you know to do nothing in a situation, especially if there's so much going wrong, it's like your soul will be destroyed, and that's not a matter of a question. Like it
Mm-hmm.
will happen. Like your soul will absolutely be destroyed if you had the opportunity to do something you didn't.
Mm-hmm.
But you have to be careful. You have to do it the right way. You have to be prudent and wise. So using any information of or knowledge of wrongdoing and then giving that to people who can do something about it. So serving as essentially informants or whistleblowers while maintaining their anonymity. Because say your cousin is applying to residency, but the medical school knew that he held certain views or you know um, exposed something that happened in the medical school, they will absolutely 100% sabotage his chances of getting into residency.
Mm-hmm.
If your cousin is part of a pro-life organization or Republican organization and that's on their application, the residencies will discriminate against him. If he's in a residency and something like this happens, they will kick him out. There's no question. He will get blackballed. Um, and it's when you're in medical school and residency, you're you're fully prone to um, uh, their power because they're the ones who advance you through. But you should still speak out, do it wisely, and then if there's anything like really bad, you can give that information to me, and I'll do something. I know the people
Absolutely.
who could
That's
do
great.
something
Yeah.
about it. Yeah.
Yeah, awesome. I'll definitely talk to him about that too, and just relay that to him so he knows there are people to reach out to, and like, and even professionals like you who you've had that experience of going through that process of disclosing that information that people need to
Well,
know.
I
And
can tell
yeah,
you as a matter of fact. Um, well, just because it's going to be public, just I'll leave it at that because I know how to get things
yeah.
done. That's it.
Hmm.
Yeah. So
Awesome, awesome. Um, so is there anything you want to say to, I guess, also like other physicians who may be too afraid, or even not really thinking like it's a big deal to speak up about it because they either don't think that the numbers are that high in terms of the number of children who are being affected by this, or whether it's just they're too afraid to speak up. Like, is there any advice you'd give to those physicians?
yeah, I'd probably just call him a coward if with yeah, with in a endearing kind of way,
Mm-hmm.
hoping that they would um, uh, change their behavior. Because a lot of times when you're very honest with people in a way that gives them a road to kind of reclaim their morality, a lot of people will do something, right? But you can't give people an out. You can't be like, oh well, like I mean, I remember talking to so many
Yeah.
doctors where they're like, oh well, if I do this, I might lose lose my job. But I remember talking to a doctor who they had knowledge of something so unbelievably controversial at their hospital. I mean, this would have been a massive story and it would have really changed things like nationally. But they were too scared of losing their job or just being disciplined by like the
Mm-hmm.
administration of their hospital or anything.
Yeah.
There was nothing in them making this information public that was in any way illegal or unethical or anything, but they were still so scared, and it was like, and these were older people who already had tons of money. These doctors who were already far into their careers, just and and I didn't do it at the time, but if it were to happen now, I would tell that person like it's shameful and it's cowardly to do that,
Mm-hmm.
and your children should be ashamed of having a parent like you. You know that you will permanently give that lesson to your kids. You will
Mm-hmm.
permanently disgrace your family's name. Yeah, that's what we should be telling doctors who don't speak up. Um,
Yeah.
and for
Yeah.
medical students and residents, like, yeah, like the shame comes to you too. If you don't do something, you just have to try to do something, and do so in a different way.
Yeah, the thing is, if every person, or even like a big majority of people, maybe even a smaller number, like had spoken out at the beginning, like when those initial things come to them and they're like, wow, this is not right. This does not feel right. Like if they would have all spoken up, we wouldn't even be here right now
Yeah.
for the most
When
part.
I
So
was in
yeah.
medical school between 2014 and 2018, um, it was still kind of like this um, like things really got bad after 2020, but in 2014, 2018, it was kind of it was starting to be integrated into the curriculum. Of course, all the professors, the administration, they were all like liberals, but you could still speak your mind freely. And I went to a smaller medical school in Florida, so it was kind of a different environment. It wasn't like the very prestigious, very um, kind of censorious environment. So
Hmm.
the professors would try to bring up these crazy ideas about abortion and gender. And there was a core group, maybe a few of us, 5 or 6 people, who would always say something. And because we would speak out, the entire group of people, our entire class, medical school class, everyone who was in there would end up being on our side because it was a simple exposure that you had a few people willing to speak out, that everyone
Mm-hmm.
else was like, yeah, this is totally nuts. And I remember, seeing like the how these people were so defeated. They felt so, lost that someone would express a logical argument, and it's not like that anymore. Right? If you do that now, I mean, it's it's gonna be really bad for that person. But you still kind of have to do it. You know?
Yeah, yeah. Unless, yeah, I guess the best thing is if you can get multiple people right with you to stand up with you and also do that. It
Yeah,
doesn't stop you from being, from ramifications coming down on that
yeah,
on them, but still,
mhm,
it's more
yeah.
helpful.
And even even for medical students and residents, I do think
Mm-hmm.
that there there are things that maybe it's just not worth it.
Mm-hmm.
Because like for me, right? I mean, there were times where I was like, it's simply not worth it because if you know that the consequences are going to be so severe, but then the um, the impact of it will be not really for that much. So
Mm-hmm.
you maintain your position in this captured institution and you wait for your moment to find something very meaningful, and then you make someone who can do something about it aware of it, right? So that's
Mm-hmm.
you have to be very, very thoughtful about how to approach these things, because yeah, like there are some things that just aren't worth it. And people who are like, oh well, that's a cowardly position. It's like, no, well, that's not necessarily the case. Like, you know if it's a big story, if it's something that is meaningful, you have to share that. You can't just ignore it. But people, it is reasonable to pick and choose someone's battles.
It's amazing what you can also accomplish by just speaking common sense and having a bunch of other people also speak common sense and just shut down these crazy, crazy ideas so quickly. And I love your example about how was it when you said when you were in medical school maybe, and
Hmm.
you had a bunch of people together with you, or maybe like 5 or 6 or however
Yeah,
many it
yeah,
was, just speak up and shut down those arguments, or just like present your common sense position, and then everybody else is like, oh yeah, no, that's true, and also probably feeling I was thinking the same thing, but I was just too like afraid to speak up about it. And now that
yeah.
there's these people speaking up about it, it's like, wow, I feel comfortable to do that now too.
Yeah, yeah. So it was really a very
Mm-hmm.
small number of people, a very small
Mm-hmm.
number, and yeah, it proved effective. I mean, and it's one of those things. It's a cascade effect because even
Mm-hmm.
with blowing the whistle, right? When I blew the whistle, it was only a couple of days later that this nurse who worked in the transgender clinic reached out to Christopher Rufo and blew the whistle as well. And of course, FBI agents came to her home as well, and which put us in contact with each other, and ended up for her blowing the whistle again a year later about Medicaid fraud, alleged Medicaid fraud in the transgender clinic. Now
Mm.
both of us are good friends. I was just texting her earlier today, but uh, yeah, it's like these things can have cosmic effects, divine effects, um, and but that's kind of the point, is that when you do these things that are very scary, and that you think like, man, my life is going to get totally fucked, like that's the time
Yeah.
when you kind of have to do it.
Yeah, absolutely. No, that's the point of like this is like the point of no return. If I don't do something now, it's going to be very bad. I need to do something, take action, put forward what I need to say, and yeah. And then you can also you even though the consequences could be very severe, at least you can one sleep at night, two you protect your soul, and three you're also helping protect people from harm fundamentally.
Yeah, and it's not. I'll correct those two things. Not that you could have severe consequences. You will have
Mhm.
severe consequences, and if those
Mhm.
severe consequences do make it your way, you will not sleep at night because you'll be up all night.
Mhm.
I
That's
mean,
true.
I lost.
Yeah.
So, but it's worth it. That's the thing, is it's worth it because
Mhm.
like it's the acceptance of that reality. Like it's gonna
Mhm.
be very painful. That's like the suffering is gonna be a nightmare. But like when I was in the worst of it, my wife and I, like my wife was 6 months pregnant when I was indicted, right? When three heavily armed U.S. Marshals came to our home at 7 in the morning, like we were like drug smugglers, right? And like she was pregnant at the time, and it was it was so terrifying to think that we were going to lose everything. I might be confined to a cage for 10 years, and for doing nothing wrong. But then we thought about what these doctors were doing to these kids, and all of that pain and suffering just kind of melted away because you understand what you're fighting for. That our own plight wasn't that bad compared to what these kids had been, how these kids had been harmed. So,
Mhm.
but then also now it's like, even when you're in the fight, it's like there's something about fighting back, even when these people harm you. Like they do all these things to you, and
Mhm.
then standing up, holding your head high, and like refusing to bend the knee. There's a satisfaction in that that is indescribable, right? It's like, yeah, you might suffer a lot, you might lose sleep, you might lose a whole bunch of money, you might lose everything, but like the feeling of standing up, not kneeling, is it's like you get transported to this different world. You didn't think you were possible of doing something, but then you did it, and it's like there's no feeling like that.
Mhm.
And it's like this. You have to be willing to jump off of a cliff without like any parachute and hope that you know something's going to save you, right? But then you realize that it's actually, there's a floor below, right? That there's this entirely new plane of existence that you can be, that it's the world's so much better on the other side. Like it's it's not as bad as you think, even if the
Mhm.
material risks are very high. Like even if I
Mhm.
went to prison, I was I was mentally ready to go to prison. Like, and I really mean that. Like I was not scared. I was not anxious about it. I had accepted it because I knew that if I was incarcerated, I had done it for a righteous reason, and
Mhm.
and I would never give these people the satisfaction of knowing that they had broken me.
Mhm. Yeah, even things that are incredibly difficult that have really, really severe, even potentially deadly consequences. If things are done for a correct cause, righteous cause, you're stopping harm, you're doing whatever it is, it's oftentimes provides that meaning to those actions and deep fulfillment, deep meaning. And but it has to be done in, like you said, in a smart way, in a moral way, and but that action gives you that that peace.
Mhm.
And even in those really, really incredibly difficult times. So yeah, absolutely. I think I love what you
It's kind
said.
of like
It's
a
beautiful.
combination of like you have to be wise, judicious, but then also there were other
Mm-hmm.
times where it would be like recklessly aggressive, but recklessly aggressive in a very well thought out way. Because
Yeah.
when I
Mm-hmm.
took my story public for the first time, I was anonymous for the first 6 months after I blew the
Mm-hmm.
whistle and the feds came to my home. So I was like just getting my life destroyed behind the scenes. No one knew I was being investigated. I just started my first job, and it was just a nightmare. And I thought, these people are going to destroy me unless I tell this story publicly. And I thought, if I'm going to do this, I'm going to go all the way. Like, I'm going to kind of really blow things up, right? Like, light a match to it and just throw it down the hatch. Just be as aggressive as I can. And but it was thought out, where it's like, well, do we have any other option? Is there any other route? And we
Mm-hmm.
had tried something else before, it didn't work. We realized we were out of options. So it's like, once we made that point of no return, then you really cannot return. It's like called a
Mm-hmm.
point of no return for reasons, because there is no going back.
Mm-hmm.
But then also later times, there were also times where we did have to strategically withdraw and then withdraw and push. It was yeah, it wasn't just like, once you put your foot on the gas, you just keep it there. It You just take each situation as it comes and then develop the best plan to win.
Mm-hmm. What are you doing just going forward? Like in the next couple of years, like what are your plans? I'm sure you're very busy with all of this too.
Yeah, well, so we had our first daughter during the prosecution. After she was born, I had to leave like an hour after she was born. My wife had an emergency
Wow.
C-section to go to court, which was awful. But you know, our plans were to have a family, to have more kids, for me to do surgery, and then to do whatever we can to stop what's going on.
Mm-hmm. Awesome. Well, I think we can cut it off here. I really enjoyed the conversation. And thank you so much for doing this with us and spending your very busy day and just days in general, just talking with us today is great.
Of course,
So
of course.
yeah, thank you
I
so
appreciate
much.
it. Thank you very much.